Walking speed is increasingly used by doctors and researchers as an indicator of overall health in older adults. Some studies have found that it can be as informative as measurements like blood pressure or cholesterol when assessing long-term health outcomes. Unlike those measurements, walking speed can be observed without equipment, which is part of why it has drawn attention from researchers studying aging populations. This script examines how walking patterns change with age, why those changes matter, and what current research suggests can be done about it. The focus is on mechanics that can be observed and adjusted during ordinary daily walking, rather than on specialized exercise programs. This distinction is relevant because walking is already part of most people's daily routine, which means adjustments to its mechanics do not require setting aside additional time or learning an entirely new activity. After age 70, walking patterns tend to shift gradually. Steps become shorter, the feet lift less, posture leans slightly forward, and arm movement decreases. These changes often happen slowly enough that they go unnoticed by the person experiencing them, since each individual walk feels largely the same as the one before it. It is often family members, caregivers, or clinicians who notice the cumulative shift over months or years. Researchers refer to this pattern as gait decline. Longitudinal studies tracking older adults over time have found associations between slower walking speed and a higher likelihood of falls, hospitalization, and reduced life expectancy compared with people who maintain a steadier walking pace. Because of these associations, some researchers describe walking speed as a useful indicator of general health status, comparable, in some respects, to standard clinical vital signs. This has led some clinical settings to incorporate simple walking speed assessments into routine evaluations of older patients, alongside more traditional measurements. Several physiological factors contribute to this decline. The first is muscle loss. Many older adults experience a gradual decrease in muscle mass each year, a condition known as sarcopenia. This loss tends to affect the lower body in particular, including the muscles used to push off the ground and stabilize the hips during each step. Reduced muscle strength in the legs is associated with shorter, slower strides, since the muscles are less able to generate the force needed for a longer step. The second factor is a decline in balance control. Balance depends on coordinated input from the inner ear, vision, and sensory nerves in the feet, all of which send signals to the brain about the body's position and movement. As these systems become less efficient with age, the signals they provide become less precise, and the body often compensates by taking smaller, more cautious steps to reduce the risk of losing balance. This compensation is generally an unconscious adjustment rather than a deliberate choice, which is part of why gait decline can progress without the individual noticing it happening. The third factor involves cardiovascular strain. When stride length shortens and movement becomes less efficient, the heart works harder to cover the same distance, since more steps and more energy are required to travel the same path. Over time, this added effort can place additional strain on the cardiovascular system, particularly during activities that require sustained walking, such as errands or extended time on one's feet. Taken together, these changes suggest that a slower, more restricted walking pattern is not only a sign of aging, but can also be an early indicator of increased fall risk and broader health decline. Research in this area points to several specific changes to walking mechanics that are associated with improved balance and mobility in older adults, and these form the basis of the recommendations that follow. A common assumption is that improving one's walk means walking faster. Research suggests that stride length, or the distance covered with each step, is a more relevant factor than speed alone. In other words, the way each step is taken matters more than how quickly one step follows another. Shorter, shuffling steps are commonly observed in early gait decline. Longer, more deliberate strides are associated with greater muscle engagement, improved balance, and lower fall risk in several studies of older adults. Increasing stride length engages the gluteal muscles, one of the body's largest muscle groups which tend to be underused in sedentary aging populations. It also encourages a fuller range of motion in the hip joints, which can help maintain joint flexibility over time rather than allowing it to diminish through disuse. A longer stride is typically accompanied by more natural arm movement, which contributes to balance by acting as a counterweight to leg motion. Physical therapists working with older patients often recommend practicing a slightly extended stride during regular walks without increasing speed or exertion, since the goal is a change in form rather than a change in pace. This approach allows the adjustment to be practiced gradually without the discomfort that can come from attempting a significant change in a single session. Arm movement is another factor researchers have identified as significant. Reduced arm movement while walking is common among older adults, often due to stiffness, reduced confidence, or simply habit developed over years of more cautious movement. This reduction is not simply cosmetic, it is linked to changes in balance and coordination. Arm movement and leg movement are coordinated through the nervous system in a pattern known as contralateral movement, in which the right leg and left arm move forward together, and vice versa. This pattern develops early in life and continues to play a role in balance throughout adulthood, functioning largely without conscious effort until it is disrupted. When arm swing is reduced, the body loses one of its natural stabilizing mechanisms, particularly during turns or on uneven surfaces, where additional stability is most needed. Arm movement also engages the core and upper back muscles, which supports a more upright posture and can improve lung capacity by allowing fuller chest expansion during breathing. Physical therapists frequently include arm swing training in fall prevention programs for older adults, given its role in supporting balance and posture during everyday movement. In practice, this training often involves conscious repetition of the swinging motion during short walks until it becomes automatic again, since the goal is to restore a pattern the body once performed without effort. The direction of a person's gaze while walking is also associated with balance control. Many older adults develop a habit of looking down at their feet, often out of concern about tripping over uneven ground. Research indicates that this habit can have the opposite of its intended effect. Looking downward tends to tilt the head and upper body forward, shifting the body's center of gravity and reinforcing a hunched posture over time. This postural change can, with repetition, contribute to further weakening of the muscles that support an upright spine, creating a cycle in which posture and gaze reinforce one another. Balance is also influenced by where the eyes are focused. When the gaze is fixed close to the ground, the brain receives less stable information about the body's position in space, which several studies associate with an increased risk of stumbling rather than a decreased one. Physical therapists specializing in fall prevention often recommend keeping the eyes focused roughly 15 to 20 feet ahead while walking, allowing peripheral vision to detect nearby obstacles without requiring a downward gaze. This adjustment is associated with improved posture and more consistent balance during walking. Posture and gaze are closely connected to core strength. Gait changes often originate in the trunk of the body rather than the legs, even though the visible symptoms appear in the way the feet and legs move. Weakness in the muscles surrounding the spine and abdomen, which tend to decline with age if not regularly used, can make it more difficult to maintain an upright posture while walking. In response, the body often compensates by leaning forward and shortening its stride, which in turn affects the other mechanics already discussed. Because posture depends on muscular support, instruction to walk taller is generally more effective when paired with exercises that strengthen the relevant muscles rather than issued as a standalone instruction. One method used in physical therapy is wall posture training. This involves standing with the back against a wall, heels a short distance away, and aligning the shoulder blades and back of the head with the wall without straining the neck. After holding this position briefly, the individual steps away and attempts to maintain the same alignment while walking. This exercise is intended to reinforce the sensory memory of correct posture, which can become more consistent with repeated practice over days and weeks. When combined with the earlier adjustments to stride, arm swing, and gaze direction, improved posture contributes to a more stable and coordinated walking pattern, which researchers associate with reduced fall risk and greater physical independence in older adults. Each of these adjustments affects the others, so improvement in one area tends to support improvement in the rest. Consistency in applying these changes is also a factor researchers highlight. A common issue when adopting new movement habits is attempting too much change at once, which can lead to fatigue, discomfort, or discontinuation of the new habit altogether. Research on mobility and aging generally supports shorter, more frequent walking sessions over occasional long walks. Sessions of roughly 10 to 15 minutes, repeated several times a day or most days of the week, are associated with greater improvements in strength, balance, and confidence than infrequent, longer walks that may cause excessive fatigue. This pattern is comparable to other health habits that rely on regular repetition rather than occasional intensive effort. Each short walk that incorporates the adjustments described, including stride length, arm swing, gaze direction, and posture, contributes incrementally to muscle strength, balance, and walking confidence. Over time, these small repeated efforts accumulate into measurable changes in mobility in much the same way that repeated practice gradually improves performance in other physical skills. This is a relevant factor because fear of falling is commonly cited as a reason older adults reduce physical activity, and reduced activity is associated with further declines in strength and balance, creating a cycle that can be difficult to reverse once established. Research suggests that consistent, moderate activity can help offset this pattern by maintaining rather than eroding the physical capacities that support safe walking. The changes examined in this script are as follows. First, increasing stride length rather than walking speed. Second, restoring natural arm swing during walking. Third, adjusting gaze direction to look ahead rather than down. Fourth, incorporating posture training such as wall alignment exercises to support an upright walking position. Fifth, applying these changes consistently through short, regular walking sessions rather than infrequent long ones. These adjustments do not require specialized equipment or medical intervention. According to the research discussed, they are associated with improved balance, reduced fall risk, and greater physical independence among older adults. Walking patterns established over time can be modified through practice, and researchers indicate that the capacity for this kind of adaptation continues into later life, even after decades of an established walking pattern. The research summarized here indicates that changes to walking mechanics, including stride length, arm movement, gaze direction, posture, and consistency of practice, are associated with measurable differences in balance, fall risk, and long-term mobility among adults over 70. These findings suggest that incremental adjustments to a routine activity such as walking may have a meaningful role in supporting independence and reducing health risks in later life. Because each of these adjustments can be practiced without special equipment or supervision, they represent an accessible starting point for individuals interested in addressing gait decline before it progresses further.